Thank you, Mr. Speaker, and thank you to Congresswoman Clark for organizing this really important discussion here this evening. The scope of the problem in terms of what's facing our nation is pretty astonishing when you look at the statistics from the Center for Disease Control. In 2004, 7,000 Americans lost their lives to heroin overdoses. Fast forward 10 years, that number is now over 27,000. And again, the statistics land in suburban America, rural America, or urban America. But at the end of the day, behind every one of those numbers is the story of a human being and a family. And that's why this discussion is so important tonight. Next to me, I have a chart showing the face of Justice Kelly, who is a 21-year-old from Towin, Connecticut. Towin, Connecticut is the quintessential small-town New England community. It's about 5 miles from where I live. And her mother, Jennifer, moved there hoping that this was going to be a great community to raise her child, and she went through the public school system. Battling depression, she fell victim to heroin addiction, and for the last number of years has been battling this with methadone treatment in and out of facilities and programs. And last summer, she really finally went to her family and just begged them to get access to a long-term rehab program. Unfortunately, the waiting lists were months. The facilities in Connecticut, like so many other parts of the country, were full. And in August of 2015, when she, again, was in a predicament where she lost her asthma medication, the combination of suffering from asthma and a heroin overdose resulted in her being rushed to the hospital with an overdose condition. The good news is that the folks at the emergency room were able to save her life. But as her mother said, as we pulled into the parking lot, I knew at that moment I was losing her. All I remember from that moment on was being more scared than I've ever been in my entire life. I saw a whole team of people come outside and try and save my baby's life. I stood there helpless and alone. All I could do was look to God. She now is in a permanent vegetative state, as the photograph next to me indicates, and there really is no signs of improvement. Her mother went on to say, "They saved my daughter's life that day, but it's been a very hard journey. Her injury is so severe that the likelihood that she will ever recover is very slim. More than likely, I will have to make a decision to bring my baby home with hospice." This story shows that this problem extends far beyond even the fatalities. It also is going to leave people with chronic life-changing conditions like this beautiful young girl from Towin, Connecticut. Mr. Speaker, this issue is now coming to the floor this week with a number of measures authorizing different changes and approaches to this program. But I want to, again, emphasize the fact I come from the state with the highest per capita income, but even in Connecticut, people cannot find access to treatment beds. And that's why at some point we have to bring this discussion to a higher level and realize we need to get resources out to the communities so law enforcement can, at the front lines, deal with this issue in emergency situations so that we have treatment options for families like the Kelly family in Towin, Connecticut, and also that we go upstream in terms of prevention and education so that we can get to the root causes of the pathways to heroin and opioid addiction. And this is going to require an all-hands-on-deck approach. So, yes, let's support the legislation that's coming forward this week. Let's make smart policy changes. Let's authorize different programs. But at the end of the day, we need to put our money where our mouth is. We need to treat this like it's a natural disaster where we would instantly, as a nation, respond to a hurricane that's taking human lives at the clip much slower, in fact, than what's happening with the heroin opioid crisis. Let's move forward with the $600 million request for funding, emergency supplemental funding, which is before the Appropriations Committee, so that we can not just talk about solving this problem, but we're also going to, again, put the resources out there so that the police, the addiction counselors, the treatment folks, all the families that are out there desperate for help know that our country is going to treat this as the true crisis that it is and get the resources all across the country. So again, thank you to Representative Clark for organizing this discussion. Jennifer Kelly, Justice's mother, thanks you for letting us have an opportunity to tell the story about her daughter. And again, as a nation, let's move forward with all the resources and all the good ideas forward, because that's the only way we're ever going to come to terms with this problem and solve it. And with that, I yield back.